Promoting interoperability. How do we do better in PI?
If you want to score well in MIPS, you can't neglect the promoting interoperability category. There are a number of special circumstances that render this performance category irrelevant. If so, the points will be redistributed to the remaining performance categories, making each of them that much more important. To earn points in the promoting interoperability category, first you have to be using an EHR. It has to have up-to-date certification as specified by the Office of the National Coordinator of Health IT, called the ONC. And you need to be able to show that you're using it in certain ways. This can have a significant price tag to license the software, to acquire and maintain the necessary hardware, to train users and maintain skills, and to implement associated functions. Those functional requirements include: you have to be electronically prescribing with the system. You have to query your state's prescription drug monitoring program if you're prescribing any controlled substances. You have to exchange electronic health records with clinical partners, receive them when you're getting referrals, send them when they're making referrals. And it's more about capability than volume of use. You have to show you can do it and that you've done it at least a measurable number of times. There's a few options to make this part of it work. You can do direct exchange between clinical partners. You can use a regional health information exchange, or there's a national program you can sign on to that pushes you in that direction. You have to provide patients access to their health information. Now, most organizations do this with a patient portal. That patient portal might come with your EHR, or it might be an independent add-on. There are expenses related to licensing, implementation, maintenance, and operation, but again, it is a required function in order to get your full points, or any points for that matter, for promoting interoperability. You have to exchange data or be in the process of implementing a data exchange with your state immunization registry and with your state health department for mandatory case reporting. Now, and there's also a number of attestations required to pass the promoting interoperability performance category. Attestations about usage, attestations about lack of restrictions on access, your security precautions and knowledge. Again, most deficiencies in your proof of use result in a 0 score on the entire category. If you don't have at least one prescription, at least one exchange of data, if you're not able to show that, most result with a 0 score on the entire category. Now, there are a number of limited exclusions available for any particular category. They're usually temporary. They have a limited number of years that you can use them. And if you win them, they result in a redistribution of the available points, not a forgiveness of those points.